Hello, good morning. My name is Denise Yapomaide, and as always, I bring you AM News. The Deputy Minister of Works and Housing and Member of Parliament for the Kwesimintim constituency, Dr. Prince Hamid Ama, has witnessed firsthand the flood situation in the Kwesimintim municipality. During his visit to assess the progress of ongoing drainage construction, the minister was caught in a downpour. He remarked that the experience highlighted the urgent need for measures to prevent severe flooding or the consequences of flooding. Correspondent Adabraka Sahara has more in this report.
With the intention to inspect drainage construction projects ahead of the rainy season, Deputy Minister for Works and Housing, Dr. Prince Ama, began his tour in Kwesimintim. Just an hour into the inspection, torrential rains hit, providing Dr. Ama with a first-hand look at the severe flooding issues that plague the constituency.
You look at what's happening here, it's obvious that the people of Kwesimintim constituency are really suffering. You can see all over the place it's flooded. And basically, it is because this constituency is a low-lying area. Across the whole of Western region, Kwesimintim is a low-lying area. So when it rains, the least rain, you get the whole place flooded. And as you can see, wherever we've gone, we've seen flooding all over the place. This is somebody's house. The rain is already gone into the corridors of the house. You can see the car there parked in front. The whole place is flooded. There's a drainage. Yes, there's a drainage here.
Throughout the inspection, it was clear that the flooding had rendered many roads impassable and submerged vehicles. Municipal Urban Road Engineer Wilson Amagache explained that narrow culverts are a significant part of the problem.
See that much of the water is coming from the right-hand side, passing through very small culverts. This is a bottleneck.
Okay.
Yeah, this is the major cause of this flooding. This culvert needs to be bigger so that you can be able to take all the water coming from here across. And even that, after we have crossed it, we have to take it to the discharge point, which Hydro has done a bigger drain about 300 meters from here.
Okay.
So when we are considering solving the problem, the crossing it and also connecting it to the down.
Abdul Ganiu is the Western Regional Director of NADMO.
Very soon, I believe with him, we are going to have a lot of construction happening within the flood-prone areas so that life and property will be protected in this community.
Key areas such as Racecourse, Anache, Window, and Apollo remain severely affected by the flooding. Dr. Ama emphasized the urgent need for immediate and additional measures to prevent future flooding.
Even though we haven't gotten to the thick of the raining season, this is just the beginning. But you can see the little rain that we've had, the whole place is flooded. We've gone to other places and we've seen. The work of the ministry, where I happen to be a deputy minister, involves dealing with flooding situation. And the ministry has a program on the national flooding control management. So I think this will be a very good case to make so that we can get some support. Yes, I think we will have to engage the engineers. They are the experts to be able to indicate to us to what extent will the occurrences, what we are seeing now, inform any alteration of the existing programs that we are doing.
As Kwesimintim continues to battle the effects of flooding, swift and comprehensive action is required to safeguard the lives and properties of its residents. Reporting for Joy News, Adabraka Sahara, Western Region.
And from the western region, let's move to the Greater Accra region because residents of Adabraka Sahara are asking authorities to construct gutters to address their severe sanitation issues. They claim the government has neglected their area, possibly due to its strong support for the NDC. Sweetie Abochi reports from Adabraka on today's episode of Filth Exhibition.
This is Adabraka Sahara, right here in the heart of Accra. And this open gutter, you see, is right in the middle of the street where about 2 school buildings are. Now, it's the morning after about 6 hours of heavy downpour of rain. And we came to assess the situation here. Aside the filth that has engulfed this community, the issues that they raise are alarming. They speak about the neglect of the ruling party because this is not an NPP stronghold. Let's hear the story of filth from the horse's own mouth.
My name is Joe, and my issue is that they say this is an NDC zone, so they won't construct a gutter for us. They have fixed those in the market in Odona, but left this one. Is this nice? Those they have fixed are in hidden places, yet this open one has been neglected. Government, come and construct the gutter for us. As for me, I will not beg the government because they don't beg me to vote for them. They should fix it if they want. Otherwise, they can leave it like that.
Livingston is one of the residents who live here at Adabraka, and he wants to speak about the dire circumstances they find themselves every time the rains come. Let's hear his story now.
When the rains come, we suffer. The place becomes dangerous. They don't drain the gutter as well as they should. AMA was here last week, and this is the result of the work they did. This is why our homes get flooded when it rains. They have politicized the whole thing, but we are all Ghanaians. Initially, they used to bring machines to drain the gutter, but now they use their hands. How would they do a good job? Malaria is a common disease here. It's so worrying. Our children are constantly falling sick. We need government to come to our aid.
My heart goes out to residents in this community, people who live here, who work here, and the students who use this road on a daily basis to get education. If indeed this is an intentional neglect of the ruling New Patriotic Party, because this is not an MPP stronghold, and if again indeed this is the best work that the AMA can do to distill this gutter, then we are faced with a dire sanitation crisis. And only God knows to what end this goes. For Joy News, I'm Sweetie Abochi.
Let me now take you to the Ashanti region because the Emergency Medicine Society of Ghana is warning of first-hand repercussions of climate change on health systems and communities in Ghana. They say the rising temperatures and changing weather patterns are shifting disease patterns and intensifying the spread of infectious diseases and also exacerbating existing medical conditions. Clinton Yeboah has more in the following report.
Climate change continues to wreak havoc in many parts of the world. And in many sectors of the country, now experts are recognizing it. Health officials and health experts here at the Komfanochi Teaching Hospital are not so happy. The altering of global climate is rising the heat in West Africa. Under high emissions scenario, the number of severely hot days per year is projected to increase to 140 days by 2060. Many areas in Ghana are experiencing an uptick in climate-related disasters, including floods, storms, and wildfires. While over 45,000 Ghanaians are impacted by floods yearly, 13% of the country's population is estimated to be affected by drought. The impact of climate change extends beyond direct health effects, permeating every facet of emergency medicine. Heat waves, once rare occurrences, have become more frequent and intense, leading to heat-related illnesses and deaths. Komfanochi Hospital's emergency medicine department says the signs are already on the wall in Ghana. Deputy Chief Nursing Officer of the Emergency Medicine Department of the Komfanochi Teaching Hospital, Georgina Adamte, confirms the unit now receives overwhelming numbers of breathing complications from the new weather.
We have a lot of cases. Our cases has been increased. Respiratory tract infections, the people come with difficulty in breathing. It has been in increase. We have a lot of patients coming with difficulty in breathing. Because of the weather, a lot of patients have infections in the chest and they come with difficulty in breathing, cough. Others come with runny nose.
President of the Emergency Medicine Society of Ghana, Dr. Daniel Osei Kwame, speaks of looming health dangers linked to climate change.
The rising temperatures, the erratic weathers, they all pose a myriad of health risks, exacerbating existing medical conditions and giving rise to new challenges. Prolonged droughts threaten food security and nutrition, increasing the prevalence of malnutrition and its associated health complications, particularly among the children and the elderly, as well as the vulnerable in the society, which not only cause physical injuries, but also overwhelm our health infrastructure and resources. Climate change acts as a catalyst for the spread of infectious diseases such as malaria, dengue fever, and cholera, as shifting temperatures create favorable conditions for vector proliferation as well as pathogen transmission. The burden of these diseases falls disproportionately on marginalized communities.
Medical experts are being advised to leverage their expertise, knowledge and influence to mitigate the health impact of climate change and foster sustainable solutions. Dr. Daniel Osei Kwame says partnerships with policymakers, researchers and community stakeholders will help develop evidence-based strategies and policies to safeguard public health.
We are the frontline responders. We've been equipped with skills and the knowledge to triage and treat patients who are affected by climate change emergencies. Whether it be flood-induced, a heat stroke victim, or an infectious outbreak that has been exacerbated by an environmental factor. We cannot afford to ignore the nexus between climate change and health. We must prioritize climate adaptation and disaster preparedness within our healthcare system, investing in robust infrastructure, training, and capacity building. We must engage in interdisciplinary collaboration, forging partnerships with policymakers, researchers, and community stakeholders to be able to develop evidence-based strategies and policies that will safeguard public health in the face of the climate change.
Now, experts are warning of the impending damage of climate change in the lives of many Ghanaians. They are, and however, believe that a concerted effort from authorities could be a solution. Reporting for Joy News, my name is Clinton Yabua.
Now, menstrual health advocates are calling for menstrual pad banks to be installed at least in every school to support girls. The advocates say such a move will help many girls who are unable to afford sanitary pads to have access to them. They've been speaking at the celebration of the World Menstrual Hygiene Day in the Central Region. More in the following report.
The World Menstrual Hygiene Day marked at the Aswansi Technical Institute in the Adabraka district of the Central Region. The advocate.
It was launched, I think, 2-3 weeks ago. So we hope to also replicate that in the district so that we can have enough sanitary pads and then we can also distribute to our schools so that those girls who are, excuse me to say, needy can also have access to these sanitary pads, because it is one of the causes why students stay out of school most of the time, especially when they are menstruating.
School Health Education Coordinator at the district, Merfo Gansa, explains why such support is needed.
When it comes to menstrual hygiene in our schools, our girls are really struggling. Some are from homes and communities that are really struggling financially. So it is our plea that the support systems that are in place for our schools, the girls be considered in the provision of menstruation products We're talking of tampons, we're talking of sanitary pads, and possibly menstrual cups to support them in those periods. Indeed, we want to make the period friendly so that the girls will feel comfortable to stay in school and study to achieve their dreams.
The Computer Hardware Technology Department at the Swansea Technical Institute that hosted the event says the department is making giant strides to empower the girls to have a serene environment in order to stay in school.
As the department, we have made it a conscious effort of helping the girls. You can see Ghana TVET service, TVET, as Swansea Technical Institute, though the first technical institute in Ghana, we have fewer girls. The male dominates the girls. And we need to make a conscious effort of helping them to always be empowered and then learn in their comfort zone. When they come to school and you don't get such initiatives, they will feel shy. Sometimes it's because of menstrual issues. That is why some of them will drop out. And that has been the reason why we gathered today to help celebrate World Menstrual Hygiene Day.
Joel Ban is the head of department. In the Central Region, some schools and district education directorates have begun putting in place pad banks to support the menstruation of girls. Abdallah Osman's report read to you.
Let's do some election stories. The Nandom constituency of the New Patriotic Party has debunked allegations of hatching a plan to bus non-natives or ordinary resident voters to transfer their votes to the constituency. Now, the Nandom NDC, at the start of the week held a press conference warning the NPP to abandon the plan or they will face their wrath. The Nandom NPP Constituency Secretary, Woyan Martin, however, dismissed their claims, calling on Ghanaians to disregard them with all the contempt they deserve. Join News' Upper West Regional Correspondent Rafiq Salam, who was also in the constituency, reports that the Nandom EC was able to register 1,027 prospective voters during the limited voter registration exercise that ended yesterday.
The press conference held on Monday by the Nandom Constituency Bureau of the National Democratic Congress NDC and addressed by the communications officer Abdul Rahman Yakub alleged of plans by the Nandom New Patriotic Party NPP and its 2024 parliamentary candidate Ambrose Zere to bus non-natives or ordinary resident voters who have no connection to the Nandom constituency to transfer their votes in the upcoming voter transfer exercise slated to start on the 30th of this month.
NDC in the Nandom constituency wishes to draw the attention of all stakeholders, including the security services, the Electoral Commission, the media, and political parties, especially the governing New Patriotic Party. We, the NDC in Nandom, have become aware of some Machiavellian antics to bus non-natives and voters who are not connected in any way to the Nandom constituency, and which is against the electoral laws of Ghana. Across the country, they plan to bus people across the country to transfer their votes and bloat the Nandom constituency register in the upcoming voter transfer exercise, which will come very soon.
They stated that they will not sit aloof and allow self-seeking and rented elements to choose inept and clueless leaders for the constituency.
If they transfer non-native to the police station, will burn the buses, because the law says that you can leave them at anywhere. They will walk to the center and do their transfer. I think from there we'll be able to determine who is this person coming, and they cannot bring them in bulk. About 3 buses, they all drop there. That means they are bringing war. And in order to stop that, we all want to put fear, just like what we are doing today, from the people to know that if you're also a bad driver and you hear this, you will not come to the center with what? With the people.
Nandom Constituency Secretary of the NPP, Woyan Martin, described the NDC PESA as lacking merit and, for that matter, much ado about nothing.
It's now time for Business Update with Sweetie Abochi.
Now let's do some business news, starting with banking consultant Dr. Richmond Ituahene is impressing on the Bank of Ghana to track, trace and capture remittances as a short-term measure to stabilize the cedi. According to him, it's about time the regulator puts in place a mechanism to receive all remittances to support the cedi's stability. Now, speaking to Joy Business at the Ghana National Chamber of Commerce and Industry National Dialogue Series, Dr. Ituahene asked the central bank to take urgent steps to address the depreciating cedi.
Onto the foreign exchange. So when I say track, trace and capture, what I mean, they should go by the old ways where we can capture all remittances rather than people becoming owner of the foreign exchange, which is in contravention of the Foreign Exchange Act 2006. It's the first short-term strategy, and that we're saying that we should do it as fast as ever. They know them. They can bring them on the table and tell them, Charlie, what we did, now it's not good for the currency. Why don't we do the right thing? So they should take the urgent steps to do that. That's why I call this as a short-term strategy.
The Social Security and National Insurance Trust, that is SSNIT, contributions from private businesses have hit a record high in March this year. The Bank of Ghana data puts it at almost 400 million Ghana cedis. George Wiafe has the details.
Contributions from private sector over the last 3 years and even before COVID-19 has not been doing that well. However, fresh data from the Bank of Ghana show that the situation has improved significantly. Some are linking it to the business situation of these enterprises in the country picking up strongly. Others are also the view that the data can be used to carry out some assessment of how businesses are currently performing in this economy. The development may go a long way to improve contributions and put the State Pension Trust in a strong position to meet its obligations in the coming months.
And that's it for business updates. Handing back over to Poma.
And that's it for AM News. But don't forget that we have the news review right after AM News. My name is Denise Yapomaide. Enjoy the rest of the show and have a lovely day.